So rehabilitation for MS typically includes physical therapists, occupational therapists, and speech therapists, among others, but those are kind of three primary characters. So this particular presentation was titled Provider Communication is Key for Providing Proactive Rehabilitation in MS. And the idea was really, historically, rehabilitation medicine is under-referred. So people with MS know they need to see a neurologist or internal medicine doctor, but they have other symptoms. And so rehabilitation medicine really can offer some help in dealing with those symptoms. People with MS are often referred to rehab later, so after they have symptoms. So the goal of this presentation was really to try to drive home the point that rehabilitation could be really beneficial really from the very beginning. And so what we did is we had a panel, and we have acknowledged that really care for people with MS is multifaceted. There's kind of a psychosocial component to even acceptance of having this diagnosis. And then on top of that, for example, they may have symptoms that they don't even know can be addressed yet. So for example, someone might say, I'm pretty much fine, but I have to lift my leg up when I get in my car and think it's just old age that's affecting them, when really there are things that a physical therapist could do to address those particular kinds of complaints, because it might just be strength that they're not using and that they have the capacity to use. So part of this discussion was to have two physical therapists provide a lot of different examples of how a PT can be really helpful to someone with MS, even in the early stages when it's not really obvious that they have symptoms yet. In terms of occupational therapy, many times people will come to us and say, I have just a little bit of tingling or numbness in my hands, or I have this fatigue that doesn't get better when I take a nap. And there really isn't, we don't know of a medication that can fix that, but occupational therapists can work on strategies that can allow people to address some of those issues and allow them to keep doing what's important to them. So, because these kinds of issues can affect your work environment, it can affect your ability to take care of your family. And so having an occupational therapist to go to and ask questions, try different strategies that might be really personalized to your particular situation can be really, really helpful to people with MS. And then third, we had speech therapists there, really describing some of the issues that people with MS will describe are troubles with fluency in talking. And again, that might not even be seen as an MS issue, but it's so common that it is an MS symptom. And speech therapists can specifically address that with certain types of interventions. Other issues are problems with dysarthria or dysphagia. So speech therapists are trained to treat swallowing disorders and verbal fluency issues, and these are red flags that come up but might not even reach a physician's ears in the very beginning, because the patient and the physician are so focused on kind of getting people on DMT. So I think our message for this particular session was really try to listen into some of these points that your patient might provide that sound like minor issues but really are affecting them functionally, and take advantage of this rehabilitation team that exists out there. Refer people to us even in the early stages of MS.